Hello, my name is Dr. Shahad Abulanain, and I'm the correspondent for MedEdge MEA at the first annual meeting of the Emirates Clinical Chemistry Society and the Digital Health and Laboratory Medicine Forum held here in the beautiful city of Dubai. I'm very honored to be joined by Professor James Nichols from the USA, an expert in clinical chemistry and point-of-care testing. How are you, Professor, and welcome. Thank you for being here.
Doing very well, and I want to thank you. I'm so honored to be invited to speak at the first inaugural meeting of the Emirates Clinical Chemistry.
It's our honor to have you. Thank you very much. Before we dive into digital health, can you kindly introduce yourself to our listeners?
Sure. So I am James Nichols. I'm a PhD, and I am a professor of pathology, microbiology and immunology, and medical director of clinical chemistry and point-of-care testing at the Vanderbilt University Medical Center in Nashville, Tennessee, in the United States.
Wonderful. How are you finding the conference so far?
I think that it's wonderful. Speakers have been great. Everyone is very collegial, so it's great to meet old colleagues and
connect with
introduce to new ones.
Yeah, that's lovely. It's always the new connections that are very exciting as well.
Absolutely.
What did you like the most, since we're nearing the end of day 2?
I loved yesterday. I think all of the genomics and metabolomics and everything and how it's integrating into cancer therapy and personalized medicine was great. And today it's all about digital health.
Right. So since we're talking about digital health, let's discuss how digital technologies are reshaping the management of chronic diseases. We'll start by a small introduction into what digital health is and how it's being incorporated in the management of chronic diseases.
Sure. So digital health is really defined as all of the electronic devices, applications, Internet of Things that connect devices to medicine and personalized health care. So it is making our lives more efficient, more economical, and it's improving patient care, particularly in chronic disease. Chronic diseases are those diseases that impact patients' lifestyle for at least over a year, and they are primarily cardiac, diabetes, there's chronic renal failure, and other types of chronic disorders.
And from your experience and observation, how did digital health evolve in the past decade?
Yeah, I think that if you kind of remember back in the 2010s, Apple introduced the Apple Watch, Google had Google Fit, and there were all of these wearable devices. And that was sort of the first what we would call mobile health devices or wearables that sense biometric data, heart rate, blood pressure, your body temperature, and could be integrated into the patient's system.
Definitely. And what is the most significant innovation from your perspective that is making the most impact in chronic disease management?
Well, I'll come back to diabetes. Diabetes is certainly taking its toll. I believe that they're talking about more than 500 million patients have been diagnosed with diabetes, and that's going to almost double within the next 10 to 15 years. And most of those individuals are in developing nations and don't have wide access to patient care. So one of, I think, the most significant devices that we've had, which is not a mobile device, but is really glucose meters for dosing of insulin to type 1 diabetics. But there's a growing population of insulin-dependent type 2 diabetics.
That's true.
And those individuals can really benefit from newer developments that have been approved and FDA approved in the last several years. And that's your continuous glucose monitors. These are sensors that are applied to the skin that have a tiny needle that is inserted and it samples from the interstitial fluid and monitors glucose levels over time. They last a week or two, and they sense glucose levels every several minutes. So you collect a considerable amount of data off of these devices, not just point ecoses every several minutes, but the applications use AI algorithms to smooth that data into curves. And so the application can actually calculate rate of rise, rate of fall, and it can predict hypoglycemic or low glucose levels before they actually happen. So for the patient, it will give an alarm, and the patient can prevent that hypoglycemic event by eating.
It's a very interesting and fascinating technology, especially and convenient now as well because it's widely accessible to patients.
Yeah.
So it's a very, very nice technology. Thank you very much for shedding light on that. Everyone's talking about the advantages of digital health and how it's making significant impact when incorporated in healthcare. But from your experience, what do you think are also some challenges or concerns about digital health in medicine?
Sure. I would say that, digital health and wearables like continuous glucose monitors have really improved the patient care for diabetic patients, because previously they would have to do multiple finger sticks a day. Those are painful. Patients don't like that. So by just applying a continuous glucose sensor for over a week or two, they're eliminating those painful finger sticks. The problem is that data does not get into the patient's electronic medical record. Many of these devices and the watches and other wearable sensors don't have interfaces to electronic medical records. So what it requires is for the patient to print out their data from their application or their phone and then hand that to their clinician when they go to see their primary care physician every couple of months. That's unwieldy. That requires manual scanning into the chart or manual writing of the results. Those are error-prone, and they can make the mistake that they can be mistaken for true laboratory results like glucose meters or lab glucoses or blood gas glucoses. So these are clearly monitoring results, and they're separate, not under the regulations and laboratory quality standards of traditional laboratory tasks.
Are there some concerns about privacy and ethical issues that may arise since it's collecting so many data and personal data about patients as well? Is there some concerns that have been reported related to that?
I think that the big companies, these data companies like Apple, Google, have volumes of data, not just like continuous glucose data, but their heart rates, their fertility cycles because of body temperature, their sick, well, sleep time, wake time, exercise times, how many steps they do a day. All of this data exists side by side with personal data that the patient may enter into their records. That exists in the corporate cloud of that manufacturer. It isn't really being downloaded, but the manufacturer has algorithms that they can run to predictive model future events for patients. Since so much data has confidential amounts of personal information, that is at risk for being hacked and shared publicly, which is obviously a concern for privacy for patients.
Right, and are patients educated about that risk? Are they aware before they're advised to use any device or any technology that this can be a risk they are put into?
Oh, I'm sure that the companies have that in the fine print of their legal contracts. When you buy the thing and take it out of the box and you get the little scan code that says scan this, and here's 12 pages of corporate legal lumbo-jumbo that is in multiple languages.
When the hospital incorporates the technology, do they inform the patient that it can be a risk?
Absolutely.
Because of manufacturing.
When a patient is admitted, they are consented for care, and their physician will explain both the benefits and risks of different laboratory tests as well as technologies that they may use.
Right. I think that's important to keep the patient aware about the advantages, the disadvantages, what concerns that can arise, so they're on the same page, and also taking control of their treatment plan.
Absolutely. And we have to remember that doctors are still somewhat skeptical of the data coming from personal health devices because it's not a quality-controlled laboratory test.
Right.
And from that perspective, a lot of this data does interface into the record, so it's either manually transcribed, and it really should exist in an area of the record with other types of monitors, like pulse oximeters that measures oxygen saturation. By doing that, we can ensure that it's clearly separate from lab results, which we can calibrate, we can trace to primary standards, and which we can quality control on a regular basis.
And you can rely on as well.
We can rely on those because we have the data to support that they were calibrated and controlled. As with a watch, you take it out of the box, you put it on a CGM device, you can't calibrate it, you can't run quality control on it. About the best you can hardly do is to do a finger stick and compare it with the results you're getting off your phone or the reader of that application.
Right. So patients have to also be on the watch out for error and not...
They always should be questionable about devices because they may buy these devices and new models may come out, second, third, fourth generations. Is that first generation device still
as efficient,
as accurate as it was the later generations? Does it compare to other devices that are on the market?
Right. And what chronic disease or diseases you see have benefited the most from these technologies?
Well, certainly diabetes, that is the most talked about, but in development, there are devices that are monitoring cardiac function. So several of the smartwatches that are on the market can actually look at ECGs and electrical pulses coming from the heart. We certainly have devices that are looking at continuous electrolytes, like potassium for chronic kidney disease. There are newer devices that are also looking at kidney function and measuring biomarkers like creatinine, cystatin C in the interstitial fluid.
Right. Thank you very much for highlighting that.
Yeah.
Also, lastly, if you can give a takeaway message to young professionals who are passionate and curious about digital health being integrated in practice, what advice would you give them, and how would you highlight the importance of collaboration as well?
Sure, I would just say get involved. There are opportunities both for internships, for shadowing in the laboratories, for going into laboratory careers, starting as a medical technologist, maybe working on the bench, or if you have a doctoral track, to go into medical directorship and work in directing quality of hospital laboratories and reference laboratories, for that matter. So the best opportunity for collaboration is really work with vendors, understand the technologies that are out there, work with the current laboratorians. We're always eager to mentor young up-and-coming students, and get involved in research.
Yes, involvement and taking the initiative is definitely very important. Thank you, Professor, for the great advice and the wonderful information you've shared with us. I'm sure it's going to be of great benefit, not just to young professionals, but also to the practicing doctors in the field.
Well, thank you for the invitation, and
you're most welcome. I hope you enjoyed the rest of the conference.
Thank you.